There are currently about 140 species of mosquitoes in Sri Lanka, and only two mosquitoes species, Aedes aegypti and Aedes albopictus, contribute to the circulation of the dengue virus. These two mosquito species can be easily identified by their body making. Thank you.
Thank you, Chanaka. Dengue disease. Dengue is caused by a virus. It is a contagious disease and an infect mosquito acts as a vector. Although virus act in the transmission of the disease, DNA 1, DNA 2, DNA 3, DNA 4. In a disease caused by dengue fever, wide range of situations, some are very symptomatic while others are symptomatic. Most of those who are symptomatic may have a typical viral fever, dengue fever or dengue hemorrhagic fever with initial symptoms. Dengue fever and dengue hemorrhagic fever are most common causes of dengue and abnormal dengue condition with a very rare 40%. Dengue fever. High fever. Dengue fever is accompanied by severe headache and pain behind the edges, pain in the joints and miscellaneous, and some patients have a red rashes, sometimes bleeding condition from the germs, nose, skin. Dengue hemorrhagic fever is an acute from the dengue infection and occurs in a very small number of patients. Dengue hemorrhagic fever has three clearly distinguishable phases. The febrile phase, a period of high fever lasting less than 7 days. Vulnerable phase. The vulnerable phase begins with the onset of fluid leakage and usually as the fever subsides. This condition lasts for 1 or 2 days, and if the patient is not diagnosed and tired early, the patient may even go into a state of shock. The recovery period lasts for 2 or 5 days, and during this time the patient's appetite develops decreases. Characteristic white spot on a red background are often seen with itching all over the body, more on palms and sores, excessive ureation may also occur at this time.
Life cycle. Its mosquitoes have eclectic and terrestrial stage, and the female layers her eggs on the wet surface just above the water level in condenses of waters, and when these eggs come into contact with water, the eggs hatch into the larval stage. These larvae feed on organic matter and small microorganisms in the water and pass from the first larval stage to the fourth larval stage. After reaching the required body size and strength, the larva enters the fourth larval stage. It takes 8 and 10 days to complete this life cycle, and this is depend on the larva's food intake. The eggs of the Aedes mosquito survive even of months after enduring adverse environmental and climatic condition and severe even for many months, and because of this, even if the mosquitoes leave a stage, pupa stage and smooth stage are destroyed as soon as water falls into a bowl containing the mosquitoes' eggs. The eggs burst and mosquitoes breed again. Due to this adaptation in life cycle of the mosquito, control of dengue mosquitoes is not easy in the most cases.
Let's say the environmental factor that lead toward the spreading of dengue. Most of the time during the rainy season, the spreading of dengue catalyses. It's important to destroy the habitats of the mosquito. Mosquitoes that carry the dengue virus typically live in and around houses, breeding in standing water that can collect in such thing as used automobile tire. You can help lower mosquito population by eliminating habitats where they lay their eggs. At least once a week, empty and clean containers that hold standing water, such as planting containers, animal dishes and flower vases, shopping bags and other water gathering items, we can stop the environmental factors that spread the dengue fever.
Let us see dengue is spread by humans. Discarded plastics, clay and metal pots, decorative flower pots, barrels, bird baths, water tanks, refrigerator trays, discarded tires, dry coconut fonts and rain gutters are the places that hold water. Mosquitoes lay eggs in this way. By not disposing garbage properly and not cleaning surrounding the environment, dengue spread. Due to these human actions directly affect the spread of dengue. Thank you.
Symptoms. Middle symptoms of dengue can be confused with other illnesses that cause fever, aches and pains or a rash. Dengue symptoms: eye pain, fever, muscle pain, bone pain, joint pain, rash, headache, vomiting. The most common symptoms of dengue is fever with any of the following: vomiting, rash, any burning sign. Symptoms of dengue typically last 2 to 7 days. Most people will recover after about a week. Treatments. No specific treatments for dengue fever exists. If you have severe dengue fever, you may need supportive care in a hospital, blood pressure monitoring, transfusion to replace blood loss. In local medicine, porridge should be given with medicines that give immunity to the body, such as Monoracodumbia. By given papaya medicine, the number of reserved blood platelet in body can be increased.
My part is discuss about ways to prevent dengue. First, let's see what are the main steps we can take to prevent dengue. First, learning about dengue fever. Second, understand how dengue fever is transmitted. Third, consider your risk factors. So, let's consider the practical activities we can do for this. Stay in air-conditioned or well-screened housing. Wear protective clothing. Use mosquito repellent. Reduce mosquito habit. We will further discuss one of the most important of these, mosquito habit reduction. The mosquitoes that carry the dengue virus typically live in the around houses, breeding in standing water that can collect in such things as use automobile tires. You can help lower mosquito population by eliminating habits where they lay their eggs. And least once a week, empty and clean containers that hold standing water, such as planting containers, animals, dish and flower vases. Keep standing water containers covered between cleaning.